Welcome back. November is Lung Cancer Awareness Month, and according to the CDC, lung cancer is the leading cause of cancer death in the United States. In fact, a recent study shows 2/3 of Americans either delayed or skipped scheduled cancer screenings because of the coronavirus pandemic. Screenings are key in helping detect cancer early on before symptoms can ever show up. St. Lucie Medical Center is doing its part in the fight against lung cancer with new robotic technology. It's designed to help diagnose lung cancer in its really early stages. They are the first hospital on the Treasure Coast to use this robotic platform. And joining me this morning is Dr. Michael Layton, a pulmonologist for both St. Lucie Medical Center and Lawnwood Regional. And Doctor, thanks for being with us. It's amazing this technology is right in our backyard. So can you talk to us a little bit about this new robotic technology, what it does, how it works?
Good morning. Thank you for having me. The robotic technology allows us to access small peripheral pulmonary lesions, which we can identify on low-dose CT imaging studies as a screening tool. And the robotic technology allows us to sample much smaller peripheral abnormal areas of the lung, which will allow for earlier intervention. Obviously, the lower the stage of disease, the better the prognosis.
And so have you had instances where you actually have been able to diagnose way earlier than perhaps you would have without this technology?
Absolutely. The technology has been rapidly evolving over the last 10 to 15 years, and robotic technology is sort of the most advanced technique available now to diagnose these small peripheral lesions. We have used it here at St. Lucie with good efficacy.
And obviously it's beneficial to the patients in the fact that you would be catching cancer earlier, but is it easier on patients? Is it less invasive perhaps?
Yes, traditionally lung cancer has been diagnosed with either a transthoracic needle biopsy, where a needle is placed through the chest wall into the lesion, or sometimes bronchoscopically if it's centrally located. But if the tumor is peripheral, being out in the periphery of the lung, it's much easier to diagnose it and less invasive for the patient and carries much less risk if we do the procedure bronchoscopically.
And we know when it comes to all cancers, the earlier you can detect, the better. But talk specifically about lung cancer and why it's so important to detect it early.
Lung cancer is staged based upon extent of disease. If it's caught in its early stages, the 5-year prognosis is excellent, as high as 75 to 80% with no evidence of recurrence of disease. However, if it's caught when it's advanced, either stage 3 or stage 4 disease, the 5-year survival can be down around anywhere from 5 to 15%. So with low-dose CT screening and early diagnostic endeavors, we're able to make a significant difference and impact patients' lives.
And so people watching might be thinking, well, how do I know if I need one of these screenings? So how would they notify their doctor if they think, hey, this might be for me?
So low-dose CT screening, which is an easy test and it doesn't involve any needles at all, is a very quick scan that can be done on an annual basis for patients who have smoked 30 pack years, meaning the number of packs per day smoked times the number of years they've smoked. New recommendations actually recommend anybody who's smoked for 20 years, a package a day or more, should be screened with an annual low-dose CT screen. The studies have shown that if a low-dose CT screen is done and identifies small peripheral pulmonary nodules early, that the risk of dying of lung cancer can be reduced by 20%.
And what would you say to someone watching that said, oh, you know, my parents smoked for years and years and I was always around it. So that secondhand smoker, perhaps they worked in a restaurant or bar.
So low-dose CT screening is available for patients with a strong family history of lung cancer and patients who have smoked. With secondhand smoke exposure, it's important to discuss with your doctor all the risk factors that could potentially be playing a role in lung cancer.
All right, advancements that are going to save a lot of lives. Thank you so much for being here. Appreciate all that good information. And if you want more information on lung cancer, you can always visit cdc.gov/cancer/lung, and an amazing resource we have right here in our area. So we should all take advantage of it for sure.